we're just going down the list,
Go
Heather,
ahead.
with these questions. A little more nitty gritty. Is there a greater potential for adverse effects when multiple vaccines are given in tandem, like measles, mumps, and rubella?
Great question. No, there is not.
Okay.
Your immune system can deal with multiple things at once. Think about the fact that your immune system deals with everything you put in your mouth. How often are you eating multiple foods at the same time? Pretty much every day, pretty much every meal, right? Your immune system can deal with all sorts of things at the same time, hundreds to thousands of things at the same time.
Welcome to Influence to Death, your guide for navigating the wild world of wellness influencing. Hi, and welcome to Influence to Death. My name is Victoria Lafont.
I'm Hannah Wright, and today we have a special guest on the show. Please welcome Dr. Heather Zwickey.
Hi, everyone.
Hey, Dr. Zwickey. So Hannah and I both had the pleasure of studying under Dr. Zwickey. She was our immunology teacher at the University of Western States, and we asked her to come today to talk about vaccines and vaccine schedule. So imagining just by saying that word, we're already going to be shadow banned or...
Entirely possible.
Yeah, which we're totally cool with. Really the goal, I think for Hannah and I both, Hannah, I don't want to speak for you, but I think we're in agreement with this. The goal for this is for this to be as useful for people who feel confused as possible, and to essentially just bring a balanced evidence-based take to this topic. So Dr. Zwickey, before we start pelting you with questions, is there anything that you want to start with?
Yes, please call me Heather.
Heather, yes. Okay, sorry. Yes, of course. Okay, so Hannah, I was just going to go down this list. Do you feel good about that?
Yeah, definitely. Let's do it.
Okay. So yeah, obviously an extremely contentious topic. We have some questions, and then as people are listening, if they want to post questions in the notes, you can leave comments on Substack. And if you're hearing this, let's say on like Apple Podcasts or like that, you can find us at Influence to Death on Instagram, and you can leave questions there. We can't make any promises that Dr. Zwickey is going to answer, or that Heather is going to answer every question, but we'll do our best. So okay, the first question that I have is, do some kids need certain vaccines while others don't? For example, like if there's a caregiver who smokes, or if they have certain exposures that other children don't have.
Yeah, absolutely. So I think the first thing to remember is that the way the vaccine schedule is set up is by well baby visits. And so the vaccine schedule is a public health initiative, meaning it's treating all children as equals. And certainly there are children with different risk factors that other children don't have. It's a higher risk for developing upper respiratory diseases, for example, if you live with a smoker or you are exposed to third-hand smoke. And now most people don't know what third-hand smoke is, but it's that smoke that like you get in a car and you can tell that a smoker has sat in that car. That's because the tar from the cigarettes is still in the upholstery. So third-hand smoke and second-hand smoke are the worst. Of course, a baby is not smoking, so second-hand and third-hand smoke. But there are other risk factors. For example, having kids at home who are between the ages of 6 and 10 years old can be challenging because those kids are in school and often bring home many infectious diseases, and they don't express the infectious disease the way a baby would. And so having a kid at home who is in that age range might mean that a baby is exposed to things that other infants aren't. In addition, kids who are in daycare are often exposed to additional things. And so we might recommend more vaccines for them than we would recommend for a child who is living at home with parents who are breastfeeding, who are getting a nutritional diet. We know that living in the country is different than living in the city. Like there's all sorts of variables that go into this. And since we can't do that for public health, where we consider every single variable for every single child, from a public health perspective, we just recommend all the vaccines for all children.
Okay. And then I had a follow-up question, but that actually might be our next question, is that about the optimal schedule. So is that why they're given at the well visits? Does it have to do with more ensuring that the parent is going to get them there to get the vaccine than a certain timeline that is best for their immune function?
That's exactly right. The vaccine schedule is not set up based on immune function at all. It is set up specifically to get children as many vaccines as they can before parents stop bringing them to the doctor. And what we've seen from research is that parents are much more consistent bringing their kids to the doctor that first year of life for their well baby visits. So 2 months, 4 months, 6 months, a year, than they are after that. If we said, oh, let's start vaccinating at a year, well, parents aren't used to bringing their kids in after a year. Moreover, that puts an additional strain on the healthcare system because now you need to find additional medical assistants, nurses, et cetera, to give the vaccines for those kids who are coming in after a year. Whereas when children are coming in that first year, there's already a medical staff set up to do the well baby visits and give the vaccines at the same time. So I know it sounds funny, but it is a matter of cost and it is a matter of consistency and parents bringing their children in consistently. If you look at other countries, they actually have very different vaccine schedules because their well baby visits are scheduled at different times. So the US has a particular schedule based off of when those well baby visits are.
Yeah. And so I guess to me, that begs the question, what would the current vaccine schedule look like if it was based on immune development?
Yeah, fantastic question. So immune development is challenging. It starts prior to gestation. However, the type of immune response that you want to infectious disease doesn't really mature until a child is between 9 and 12 months for the average child. Some children have it a little bit earlier, but most kids, by the time you're between 9 and 12 months, now you have a mature enough immune response to respond to infection. What we think evolutionarily is that we evolved to breastfeed for that first year of life. And so evolutionarily, you were getting the immune response that you needed from mom. So you didn't need your own immune response. And as a result, you don't develop it. Your entire immune system isn't able to respond in a specific infectious disease way till 9 to 12 months. So the vaccines are actually given in that window when children are unable to respond on their own. What does that mean? That means that they are protective, but they are protective only for a short period of time, which is why you have to give the injections at 2 months and 4 months and 6 months, because they wear off. Whereas when you give the injections later, like the injections we give at 12 months or 18 months, they last for several years. And the injections that we give after a child is 7 or 8 years of age may actually last for 10 to 20 years. Think about when you need tetanus boosters, for example. Right? So once the immune system is mature, then we can give the same injection and get a much more robust immune response.
Wow, that is pretty incredible information. Yeah.
It is. And so you can say, well, then we should just delay vaccination until a year. But remember that women in the United States don't breastfeed for a year anymore. They used to, and some do, but certainly most do not. In fact, what we're seeing right now, I want you to guess, on average, how long do you think women breastfeed in the United States?
Not more than 2 months.
Yep.
How long is
right. 2.5
maternity
months.
leave? Yeah.
Yeah.
And it's usually exactly around maternity leave and the inability to pump breast milk in the office. And so if we made and some women can't breastfeed, right? Sometimes their milk doesn't come in and those sorts of things. But for the average woman, 2.5 months is as long as they're breastfeeding. And so those children are at risk for infectious disease and they should be vaccinated if mom is not breastfeeding.
We actually have a friend here who owns a restaurant, and she was on, I think, Iron Chef, I believe, was the show that she got picked to be on, an incredible chef. And she was, God, I want to say she was in another country, and she pumped and overnighted that milk.
Oh my goodness.
Wow.
Like a phenomenal, I mean, if she was in another country, she was very far away, but she had to like pack up that milk and send it.
Well,
Incredibly
it's so
dedicated.
interesting because in some states, there are breast milk banks. And for women who can't breastfeed, they can go to a bank and get breast milk for their infant. But that's not readily available all over the place. And it would be something that would be valuable for the health of our children.
Yeah. And just also, I mean, that's a whole other topic, just having support for breastfeeding. It's extremely hard for so many women, if they're able to breastfeed to go for a longer duration. There's just, especially if they're returning to work, pumping is a nightmare sometimes. I mean, it's
Oh,
so
yeah.
discouraging when you're trying to pump and it's the middle of the night, and you just so many factors, that
That's
we're
right.
lacking here.
Well, and we also know that in some countries there are lactation coaches, right?
Mhm.
And every parent or set of parents is provided a coach to help women with lactation. So we just don't have the culture that emphasizes that. We're really we're kind of behind in that particular area of our healthcare system.
Yeah. That makes me wonder, in an optimal, I guess, setting, if it would be possible to, keep health outcomes for the general population good with infectious disease if we were changing the way vaccines were given to babies based on screening. So screening, are they breastfed? Is there a smoker in the home? If that would, I mean, I guess my question is that idea of like the herd immunity from vaccinations,
Sure.
at that young age for infants and babies, if some aren't vaccinated, are they putting, anyone at risk? I mean, is that more the
It's a great
case for
question.
older kids and adults?
I mean, it's a fantastic question, and the experiment hasn't been done, right?
Yeah.
What we know is that for certain vaccines, you need a certain percentage of the population vaccinated. So, let's take the pertussis vaccine as an example, because pertussis is one of the infections that is circulating. We know that we have to have 75% of the population vaccinated in order for pertussis to not circulate. Minimum 75%, probably closer to 80% if we're being conservative. So that is not saying 75% of infants. That is 75% of the population, because typically infants are not transferring pertussis to each other. Unless they're in a daycare setting and one gets pertussis, then you could see infants transferring it to each other. But usually they're getting pertussis from either a 10-year-old or an 8-year-old. And when an 8-year-old has pertussis, it just sounds like a cold. It's just a cough, right? And we call it the 100-day cough because they cough and they cough and they cough. They're the most likely person, and they may be vaccinated and have pertussis, right? So the person who is what we call the vector, the person who is transmitting the infectious disease, may or may not be vaccinated. Now, if they are vaccinated, they're less likely to transmit the infectious disease. But this idea of herd immunity, where the disease does not circulate within the population, is based on the fact that we're cocooning the infant. We're taking the infant and we're vaccinating everyone around them so that they would not have to be vaccinated. We do that for children who can't be vaccinated. Maybe they have an autoimmune disease where they're on immunosuppressants, or they have cancer. Childhood cancer makes them highly at risk for infectious disease. So for those kids who can't be vaccinated, the goal is that all of the rest of us protect ourselves so that we're not going to transmit it to someone else. But the unvaccinated children are typically not the kids who are spreading the infectious disease. So are they the risk factor? No. And that's really interesting, because I see these posts of parents on playgrounds saying, well, your child's unvaccinated, you're putting my kid at risk. Well, for a baby, that's typically not the case. Now, maybe for an older child, it can be, but for an infant, they don't tend to put other infants at risk, because if they, can you still hear me?
Yeah.
Yes.
We got you.
Because if
We're just listening intently. I can see both of us in my mind's eye just zoned in.
Okay, so if the infant gets infected, you're going to know that they're sick. And then they're going to get antibiotics, or hopefully it's something that can be treated with antibiotics. We just recently had a measles outbreak, which is not treatable. Like, we do not have anything to give children with measles, which is why we actually saw some measles deaths this year. And that's the first time we've seen measles deaths in well over 30 years.
Which kind of leads into, I mean, it's at least adjacent to, we're just going down the list,
Go
Heather,
ahead.
with these questions. A little more nitty gritty. Is there a greater potential for adverse effects when multiple vaccines are given in tandem, like measles, mumps, and rubella?
Great question. No, there is not. So I hear this all the time from parents. I just want to give one vaccine at a time, and I can't. They're combined. your immune system can deal with multiple things at once. Think about the fact that your immune system deals with everything you put in your mouth. How
Mm-hmm.
often are you eating multiple foods at the same time? Pretty much every day, pretty much every meal, right? Your
Mm-hmm.
immune system can deal with all sorts of things at the same time, hundreds to thousands of things at the same time. There are millions and millions of cells that are responding. So we know that from a perspective of can your immune system respond to multiple vaccines at a single injection? Not a problem. Your immune system's got it handled. Now, what we do think about is the amount of inflammation that might be caused when you
Mm-hmm.
give multiple vaccines at the same time. Because remember, when your immune system responds, the very first thing that it does is it mounts an inflammatory response.
Mm-hmm.
And if we get a much larger inflammatory response, then we worry about the health of an infant.
Mm-hmm.
But in terms of the ability of the infant to respond, that's not a problem. The issue that we think about is the baby going to be in more pain? Are they going to have a more intense fever? Those sorts of things. And what the research shows is that it doesn't seem to make a difference.
Mm-hmm.
The difference in fever if you give MR versus measles alone is minuscule. It's not even registering. The difference in a fever response, if you add, for example, the Haemophilus influenza B to the DTaP vaccine, so the Hib and the DTaP have been combined by some companies, and the immune response is virtually the same.
Okay.
And do you want to speak, Heather, to, this is like really up right now because of the press conference that just happened with President Trump and RFK and like that, where people are starting to respond like to what they said about acetaminophen and about vaccinations. And then, kind of the sort
Oh,
of like
you
the
really want to
rhetoric.
go there, huh?
I mean, and we don't have to if you don't want to. We actually just had a pharmacist on to talk about acetaminophen and the kind of the cost benefit. And part of the rhetoric that's happening is, okay, well, a child gets vaccinated, then maybe they're so not maternal acetaminophen use, but like in children or in infants, child is vaccinated, then they're given acetaminophen for the fever. Could that be part of what we see when we're seeing adverse effects in kids?
So I think this is a really interesting question. And it's different whether you're talking about autism specifically or other behavioral health issues like ADHD. And we tend to group a whole bunch of things together. And for this question scientifically, we have to pull them apart.
Mm-hmm.
Because with autism specifically, we know that there needs to be an underlying genetic background. And then there is a combination of things that are likely happening. And it may be a different combination in each kid, which is why we can't nail it down a single cause. Could acetaminophen be one of those things? It could be, but the evidence isn't strong enough yet. And yes, the study that came out was 2 million kids that they looked at with mothers taking acetaminophen, which is why the president made the comment he did. That being said, you don't know what all of the other risk factors are that child is experiencing. So, for example, is their microbiome intact?
Right.
Is there other medications that the mother is taking that is coming through breast milk? Are there other things the child is being exposed to, chemicals in the environment, ultra processed foods, preservatives? I mean, there's so many variations that we can go through, and it's going to be different for different kids.
Yeah.
So I don't feel like I don't know if we're ever going to have the exact answer that parents want, because parents want to protect their kids. And parents aren't going, I have to control. I mean, stress alone could be having an effect, right? And so now we give you a list of all the things that you need to avoid. You've just stressed out that parent, and who knows what that's doing. So yeah, I feel like we enter a can of worms there. I think everyone's trying to do the best thing by their child. And are there things that are in the environment that are having an effect on autism, ADHD, behavioral patterns, etc.? Absolutely. Yes. And they combine with genetics. And could vaccines be one of those factors? There's been a lot of research to say they could be, but they aren't for every kid, right? And so that's why the data comes in and they're like, well, there are plenty of kids who have autism who have never had a vaccine. True. There are plenty of kids who have autism who've never been on an antibiotic. There are plenty of kids who have autism who've never had acetaminophen. Like, you're never going to see that it's a single thing because
Mhm.
that's not the way that dynamic systems work.
Right.
Dynamic complex systems have safeguards. And so usually it's going to be the addition of 5 or 6 things that all combine together and boom, there we go, right?
Mhm. Mhm. Extremely
Yeah.
rational. Hannah, do you want to ask a question?
I
Well,
try to be rational.
yeah.
Extremely. It's the most rational explanation that I've heard so far. So
So
thank you.
I'm skipping ahead on our list, but this actually is a good follow-up to that conversation. And this is the question. And again, this is a touchy subject. I know we're kind of going into this territory. So if you are like, I'm not going to talk about that, that's totally fine. But what would you say to a parent who's hesitant to vaccinate their child because they are extremely worried about vaccine side effects?
I would say that they should meet with a physician who can
Mhm.
evaluate their risk factors for because remember the infectious disease has side effects as well.
Right.
Mhm.
And so they should talk to a physician about what are the side effects of the infectious disease versus the side effects of that particular vaccine, and
Right.
then look at the risk factors for their child. I
Mhm.
find that the parents who are asking these questions tend to be the parents who are very conscientious about taking the best care of their child as possible. And
Mhm.
so they're going to look at those risk factors and they're going to say, look, otitis media runs in my family.
Mhm.
And as a result of that, otitis media is ear infections for
Mhm.
parents who don't know that. And as a result of that, my child might wind up on multiple courses of antibiotics. And that
Mhm.
is more dangerous than the pneumococcal vaccine, which
Mhm.
treats otitis media. Or kids,
Mhm.
little kids, babies die from pneumonia. Pneumonia runs in my family. Like the likelihood that my child is going to get exposed to pneumonia is really kind of high. And so I should probably consider the pneumococcal vaccine because that's a big risk factor.
Mhm.
Mhm.
I think making those decisions based on individual risk factors takes more time, takes a little bit more research, but allows parents to feel confident when they're giving the vaccine that it is the best choice for that child.
Mhm.
Yeah, and it's hard, that's also in the provider's hands too, because unless a parent, like you said, is conscientious about that, they wouldn't even know where to start, like forming those questions. And they're
No,
Right.
already
right.
tired and they have so much going on. And then with also social pressure, where if you often bring up that you want to explore those options, you can really be kind of attacked in your social circles. I mean, it goes both ways because that's such a divisive topic. And I mean, I think it comes down to on both sides is that like people care so much about their children, they just want to protect them.
That's
So
Mhm.
you see that
right.
on that side, and you see it on the side where people become extremely angry when they know some people choose not to vaccinate their children outside of medical reasons, and it's because they're worried for their kids too. It's
Mhm.
I mean, I think that what you say is so true, Hannah. And I think if we all came at this question of everybody is really trying to do what's best for the
Right.
child,
Right.
Mhm,
we would treat each other with a little bit more compassion. The
Yeah.
mhm,
other thing is I've had friends whose pediatricians have fired them
Yeah.
because they want to vaccinate on an alternative schedule. What I say is this is a parent who wants to vaccinate, not okay,
mhm,
they want to vaccinate on an alternative schedule. What else are they doing? Are they breastfeeding? Are they raising their kid in a daycare or is the child at home and not exposed to anyone?
mhm,
All of those questions are relevant. The problem is I had this conversation with the local medical school because I'm at a naturopathic medical school, NUNM, and we have a 24-hour course on vaccines. Our students learn
oh,
a
Oh
ton
my
about
God.
vaccines. So they're able to counsel a parent who's asking these questions. Whereas at our sister school up the hill, Oregon Health and Science University, those MDs are handed the CDC schedule and
mhm,
they may get an hour in their
Wow.
pediatrics class about
Yeah.
vaccines. So their ability to counsel a parent is much reduced. They haven't read all the
mhm,
studies. They haven't looked at the data. Whereas if you go through more training and you actually look at the research and start drawing those conclusions for yourself, you may actually be able to counsel parents a little bit better.
mhm.
Heather, do you have time for other questions?
I do. I have about 10 more minutes.
Okay. One question that I have is, can you speak to why the vaccine schedule has changed so much? Let's say in the past, God, I'm 43. So from I was born in 1982 to present day, or even the past 25 years.
It has changed quite a lot.
Yeah. So the first thing that has happened is they have added more vaccines. And the intention there is, again, to reduce burden, both on the healthcare system and on the parents. So let's take the chickenpox vaccine, for example. For most parents who had chickenpox, or those of us who are over the age of 35 who had chickenpox, were like, chickenpox wasn't a big deal. Yeah, it is, but oh well, right? However, if you are a parent who is in a job where you can't miss days of work and your kid gets the chickenpox, you're at risk of losing your job. That's a big burden. And so as they've added vaccines, it's really looking at how can we remove the burden from parents. It's not necessarily going, children are at such risk for chickenpox and children are not dying from the chickenpox, right? So that's the first piece. The second piece that has happened is the CDC, the Center for Disease Control, recognized that parents were associating the measles vaccine, in particular, MMR, with autism. And that was because the MMR vaccine was given at 18 months. And children who are diagnosed with regressive autism, so there's two different types of autism, there's progressive and regressive. Children who were diagnosed with regressive autism, it was typically happening at 18 months. So parents were correlating the two things. Now, remember that correlation does not mean causation. All those kids who were getting the MMR vaccine and developing autism were also wearing diapers. But were we correlating diapers with?
Right.
So correlation and causation are not linked. So what the CDC did is it said, let's make it easier for parents to not make this correlation. Let's give the MMR vaccine at a year instead of at 18 months. And that way parents aren't going to correlate MMR with autism anymore.
Okay.
Now,
Interesting.
Now, because it's a viral vaccine and it's a live vaccine, we can't give it any earlier than 12 months, because again, what we talked about earlier was our immune system isn't developed enough to handle infectious disease, and that's a live vaccine. So 12 months is the earliest you would give it because they were trying to avoid that 18-month window. And we know that you go much past 18 months and parents don't bring their kids in for vaccines at all. Parents who want to delay will often delay till 2 years. So instead of giving it at 1 year, they give it at 2 years. Is that a big deal? Not really, but it can be a big deal to a pediatrician if they have to now all of a sudden follow those parents and say, hey, you didn't give MMR. Hey, you haven't given MMR yet.
Yeah.
Again, it's that piece of, if we've got everybody on the same schedule, our computer systems can flag. That child's a year old. They need their MMR vaccine.
Right.
So there's a lot of things that are happening there. And then the other thing that we've done is we've added particular vaccines, I don't know how to say this, due to our cultural changes. So for example, hepatitis A is a vaccine that probably you guys didn't get, I didn't get when I was a child. Hep A is one of the newer vaccines. Where do we tend to see Hep A coming from? It tends to come in migrants. And we have a much larger migrant community than we used to have. So some of the additional vaccines we have is because our kids are exposed to different infectious diseases based off of
Right.
they are, right?
Yeah.
So those tend to be some of the reasons that we've seen differences. And when I was a child, women were still being told to breastfeed for the first year of life.
Right.
And Haemophilus influenza B, which is one of the ones we do at 2 months, 4 months, 6 months a year, is not something that I was ever given because my mom was breastfeeding, right?
Right.
And that's one of those that isn't, it is the protein from Haemophilus that we use in the vaccine is in breast milk. And so if a child is breastfeeding, then Haemophilus influenza B is not a vaccine that we need to give.
That is so cool.
Yeah. So lots of behavioral changes, cultural changes, changing perceptions that has changed the schedule.
Sure.
Interesting.
I think, Hannah, the last question is your question.
Yeah, the last one. So this is it's a big one, but how do you think vaccines have affected health outcomes over the last 100 years? And I'm thinking I think that sometimes we forget what infectious disease can look like when
Yeah,
it's affecting a large part of the population, because a lot of the really scary ones have been eradicated, or
that's true.
we just, because of public health measures, we just don't see them. And so I just was interested in, I mean, it can be just the facts, or like your outlook on it, how they've affected health outcomes over the last 100 years.
I had a mentor when I was in graduate school that would say, Mother Nature finds a way.
Uh-huh.
And I think that's relevant here. So we have figured out how to eliminate particular infectious diseases. And I remember when I was a child and the neighbor lady up the street had been in an iron lung, had polio, and I remembered not understanding why the way she stood was different than other people. She was in a wheelchair eventually. It was so different. And people would say polio, and we didn't even recognize back when I was a kid, which is early 70s, that polio was deadly because it was deadly in the 30s and the 40s. And I now have worked in countries with low economic resources and I've seen polio. And it's like, we do not want to have this happen again
Uh-huh.
in
Mhm.
the United States or the world. Vaccines have made an enormous impact on many, many infectious diseases. Infectious disease used to be the leading cause of death in the United
Mhm.
States.
Uh-huh.
Mhm.
It used to be the leading cause of death in most of the world. Now what we've moved to is non-communicable diseases are the
Right.
leading cause of death. Things like cardiovascular disease and cancer and those sorts of things. So that we're the frog in the boiling water. We have not seen it happen
Mhm.
because we're in the midst of it and we haven't been exposed. That said, one of the other things that vaccines have done, which I think is interesting and it's definitely something we need to address. So let's think about the HPV vaccine, human
Mhm.
papillomavirus.
Uh-huh.
Mhm.
So here we have a virus that has over 150 strains of the virus. The vaccine started with 4 strains, then 8 strains, and I think in the US we have 8 right now in our Gardasil, but there's a vaccine in Europe that has 12 strains. As we have eliminated different strains of human papillomavirus, other strains have emerged as being just as dangerous, if not
Right.
more so.
Yeah.
So when I say Mother Nature finds a way, there's always going to be an infectious disease to help control the population. That's just Mother Nature finding a way. So we saw COVID cull our population, right?
Yeah.
Humans, as we overpopulate, there will always be infectious disease that is going to kill us.
Mhm.
And so our hope with childhood vaccines is that we're not killing children,
Yeah.
Mhm.
but we're always going to have infectious disease. We're not going to eliminate it 100%.
Mhm.
We're trying to help people have the best quality of life for as long as they can. And so I think that there's a value to vaccines, and there's also a piece that we have to recognize that people are going to die of something, and people still die of infectious disease in other countries. And we're kind of spoiled in the United States because we rarely see that anymore.
Right.
We see it
Right.
among our elderly, most likely because their immune system is waning by the time they're over 50 years old. And so now you start to see them suffer from infectious disease. And that's because we can vaccinate them for as many times as we want because their immune system is waning. It's not as effective, right?
Yeah.
So how's that for a 360 answer?
That was perfect. Oh my gosh, this was the most incredible conversation. Thank you so much.
Yeah,
You're welcome.
absolutely. Thank you. I mean, it truly is, I think, public service, especially with such a fiery topic, just to remember
Mhm.
it's a topic that comes up over and over on this podcast, Heather, where we've been so trained in individual health. Hannah's now getting her master's in public health, and we're just starting to see, like, oh, right, those are interconnected but different approaches to healthcare. And so I feel like this is such a important topic in that bigger discussion.
Well, it's really timely for my family because we have a baby being born this week.
Oh,
Not me personally, my daughter-in-law. And we've been having the conversations about vaccines. And she was offered the RSV shot as a pregnant mama. And she was like, what do I do? Do I do it? Do I not do it? And so I've been watching, my own family deal with these questions and
Yeah.
figuring out what's the best choice for each of them.
yeah. Wow.
Mhm.
Well, lucky her to have you as a resource. And
Yeah.
thank you so much for coming on today and teaching us. I mean, I think Hannah and I can both say it was such a incredible gift, really, to have you as our immunology teacher. It still impacts the research that I read today. So I'm glad to get to share that with our listeners.
Thank you
Yes.
so much for having me.
Yes.
Yeah.
Thank you so much.